If you think about a woman in the late stages of pregnancy, you can get a sense of the amount of stretch that is put on the abdominal wall. And that's why an abdominoplasty or tummy tuck deals with removal of skin, fat, and often repairs the muscle. Repairing that muscle can bring the bulge inwards and tighten the waist. The look that patients are looking for, they often refer to it as snatched or not like SpongeBob, which I think are two amusing terms that describe the shape that you're trying to get when you tighten that muscle. But tightening the muscle will increase discomfort, it will prolong your recovery, and there are some patients who won't benefit from or even need muscle repair. For example, patients that have a lot of internal fat, we call it visceral fat, will have less of an effect in terms of bulging and tightening when you repair the muscle. Some patients, fortunately, don't even need muscle repair. Most of their situation is extra skin and extra fat, and the muscle can be left alone. Men typically don't get pregnant, so a man will almost never need a muscle repair. So your anatomy and your goals, your aesthetic goals, will determine whether or not muscle repair is right for you.